Hello, everyone. My name is Richard Jones, Editorial Director at Devex, and I'm delighted to be joined today by Dr. Dennis Cherian, Associate Vice President for Global Health and Nutrition at Corus International. Dennis, welcome.
Good to be here with you today.
Perhaps I could start by asking you why you feel it's so important to include faith-based organizations in conversations about healthcare. What does your work to integrate faith-based approaches really mean in practice?
Sure. Thank you so much, Richard. Faith-based healthcare workers and healthcare networks have a long history of providing healthcare around the world. And that includes essential infrastructure, community outreach, and health service delivery at all levels of the healthcare system. And what happens is in all cases, almost all cases, I would say, they work in partnership with the Ministry of Health. And in many cases, they receive service contracts with the Ministry of Health, which means they serve as extensions of the government healthcare services. And that's very true in Africa, if we take, for example. And what happens is, as a result of which, it's not just providing the preventive healthcare, but also curative and access to a number of other social services that are wraparound services, essential when we are responding to many of the primary healthcare issues that people are really seeking healthcare for.
And what's your take on the role of this approach of faith-based healthcare in achieving ambitious targets around things like universal health coverage by 2030? How is Corus International working to strengthen local capacity and really sort of help sustain these efforts?
Sure. Again, when we speak about UHC, it means that everybody has access to quality healthcare when they need it and where they need it without any financial hardships. And that's where I guess what we need to talk more is about strengthening the foundations of healthcare, which is the primary healthcare. And that's where faith-based institutions come in by bringing in other complementary interventions. For example, access to healthcare funding. For example, health financing that helps offset out-of-pocket expenses that most often are barriers to why people are not able to seek healthcare. Or in other cases, integrating with WASH services or other literacy programs that are essential to influence behaviors, but also optimal healthcare practices. And so that's one example of how faith-based healthcare are an important instrument in meeting the UHC targets that are established by the World Health Organization. But also equally, go ahead.
No, I was just going to mention, Dennis, that it's also going beyond just the physical health needs, isn't it?
That is correct, because what happens with a lot of our healthcare facilities are, it's more than just physical, but access to mental, social, also the spiritual aspects of healthcare as well, in addition to linking them to essential other social services, access to livelihoods or cash transfers, etc., that are integral. And that really did prove essential, for example, during COVID outbreak, where access to cash was an integral part of the response as well, that helped mitigate many of the burdens that people faced as a result of COVID. So it's not just treating the illness, but seeing the person as a whole, and that's what makes primary healthcare or our approach to universal healthcare comprehensive and holistic, I would say. What's often missing in terms of our routine healthcare practice.
Now, you mentioned COVID-19 just there, and I think that COVID-19 is going to remain front and center during conversations at WHA this year. But what do you think that we've learned from COVID that might guide our approach to healthcare moving forward? And as you've just mentioned, why is this holistic, people-centered approach so important, particularly in the context of a pandemic?
Sure. Thanks for that question. I mean, obviously, the pandemic has taught us that the first response always should happen and has to happen at the community level. And COVID, not just COVID, but even during Ebola, that was clear. The quick and immediate response always evolved from the community level. And the role of faith actors in responding to that has been immense, either by responding to the myths or misinformation, or increasing their access to services, or linking them to other alternative health and broader than health needs that they experience and they always require. And so that COVID really exposed that, the first response always has to happen at the community level. And it also taught us that the fundamentals of primary healthcare has to be strengthened, because the primary healthcare is the first point of contact, and where every episode of an outbreak can be prevented, and every missed opportunities for prevention, treatment can be prevented as well, and where the relationship with the client and the provider is stronger, which is essential for building trust in the healthcare system. So we saw that in COVID as well, and we will continue to see, irrespective of whether it is COVID or not, but you can see that across the broad spectrum of healthcare services that people seek services for.
No, that's great. Thanks, Dennis. And I think time is against us. So I'd ask you for one final thought. That's a call to action, whether it's to the global leaders, the policymakers, the health practitioners that are attending the WHA this year in Geneva, or indeed online and around the world. What's your call to action? What needs to happen between now and when the next WHA rolls around?
Sure. Again, the investment in primary healthcare cannot be overemphasized. We know that when investing in primary healthcare, as I earlier alluded to, the first point of contact is made stronger, and the relationship and trust in the healthcare system is further strengthened, and that is key. Second, I want to mention the role of faith-based healthcare facilities, and they has to be seen as a whole in strengthening the health system. They work in tandem with the Ministry of Health. We did a recent survey to map what is the extent of healthcare facilities that are provided by faith-based organizations. An initial mapping across 32 countries in Africa indicated that there are over 8,331 healthcare facilities. That includes teaching hospitals, health posts, regional hospitals, outposts, pharmacies, training institutions, etc. That's the tip of the iceberg. And so, but if we are able to bring together the collective assets we offer, then the impact is much more stronger than one institution trying to respond on its own. So I guess investing in both primary healthcare and trying to see how faith-based organizations can be brought into a collective response, we would be able to respond to UHC in a much more stronger manner than we are currently able to respond to. So that's my call to action at this time.
No, that's great, and of course, being greater than the sum of the collected parts. Dr. Dennis Cherian, many thanks indeed for walking us through your work at Corus International. It's been fascinating to learn a little bit more about your approach to strengthening health systems and the role of faith-based approaches in doing so. And up next, my colleague Jenny Lee Ravello is talking pandemic preparedness. So stay tuned for that and more WHA coverage here on Devex.com.